In this video, we will review the benefits of CardioMEMS and provide a little more information about how it works. The CardioMEMS heart failure system is very simple to use, and it wirelessly sends data to your healthcare provider. The sensor doesn't need a battery or replacement parts, and it provides information to your healthcare provider about your heart failure status. Your doctor will use this data to decide if changes to your treatment should be made before you start feeling symptoms. So, please continue watching to learn more about how the CardioMEMS heart failure system works for you.
What if there was a tool that would alert your doctor that your heart failure may be getting worse, even before you felt symptoms? Today, for heart failure patients like you, there is. In a normal, healthy heart, all the chambers work together to pump blood and provide oxygen to the body. In some people, the heart loses its ability to pump enough oxygen-rich blood to meet the body's needs. We call this heart failure, though it does not mean the heart fails abruptly. Heart failure is a serious and progressive disease that can make you feel weak, tired, or breathless, and may cause a buildup of fluid in your lungs, often called congestion. The heart gets weaker over time, even though you may not notice the signs of worsening disease. This silent progression is what can make heart failure so difficult to manage and for your healthcare provider to treat. Now there's a tool that will help your heart failure team identify the silent symptoms of advancing heart failure and take steps to control it before it gets worse. It's called the CardioMEMS HF System, and your doctor may recommend that you get this system. Abbott is the only company in the world to offer an option like the CardioMEMS HF System. By using the CardioMEMS HF System to measure pressure increases in your pulmonary artery, your healthcare provider will know that your heart failure is getting worse, often before you do. That means that they can recommend lifestyle and medication changes earlier to keep you feeling well and reduce your chance of a heart failure hospitalization. This small sensor, no bigger than the size of a paperclip, will be implanted in your pulmonary artery during a commonly performed procedure called a right heart catheterization. Once the sensor is implanted, you will be able to take readings of your pulmonary artery pressures at home using an external unit about the size of a queen-sized pillow. Taking a reading is a simple process that only takes a few minutes each day. The pressure readings are immediately sent to a secure website accessed by your medical team. Why is the CardioMEMS HF system so important? Because a recent clinical study of about 1,200 heart failure patients showed managing heart failure with the CardioMEMS HF system decreases heart failure hospitalizations by 58%. Using the information obtained from the CardioMEMS HF system, your heart failure medical team will be able to recommend lifestyle and medication changes earlier, thereby reducing your chances of ending up in the hospital. Thanks to advanced medical technology, people with heart failure are living better, healthier, more active lives than ever before. If you're interested in learning more about the CardioMEMS HF system and whether it might be right for you, please talk to your healthcare provider or visit www.stayaheadofhf.com. As with any medical procedure, there are risks associated with the implantation of a sensor, although complications are very rare. The CardioMEMS HF system is not appropriate for all heart failure patients. Individual experiences and results may vary. See your doctor for more information and if it is appropriate for you.